Michelle, I'll ask you if you can just sort of look at the attendees and let me know if we are approaching quorum for the commissioners or not.
We're not yet to quorum.
Okay. We'll just wait a little bit. Hope everyone's having a nice morning.
Yes, thank you, Boris.
Morning, everyone.
Good morning, Matt. We're just waiting for everybody to gather. We'll be starting in just a few minutes once we achieve a quorum of the commissioners.
Okay.
Is CB iPhone Chris Brandt?
Chris, is that you on the CB iPhone is the question. Can CB iPhone respond out there?
Boris, we have quorum.
We have quorum?
Mhm.
Great. Good. Okay, everyone. My pleasure to call this meeting to order. This is a special meeting of the Commission on Public Health, which has been established by the legislature and the governor of Maryland. Today is November 20th, 2024. The time is now 10:04 a.m. My name is Boris Lushniak, and today I'm serving as the presiding chair. I'm joined by my two co-chairs, Tosin and Mina. We tend to go by first names on this panel, and so we'll continue to do that. I go by Boris. And so just to remind you that the Commission of Public Health was established in 2023 to study and make recommendations to improve Maryland's public health system. This is a 16-member body comprised of local health officers, academic partners, thought leaders, and legislators. The Maryland Department of Health is represented by the Deputy Secretary for Public Health Services, the Deputy Secretary for Behavioral Health, and the Director of the Office of Minority Health and Health Disparities. Many additional leaders and professionals are contributing to the Commission's 5 work groups, and they'll have been exploring 5 key subjects relevant to this mission, which is funding, governance, and organizational capabilities, workforce, data and information technology, and communications and public engagement. Our goal is to ensure the public health system is designed to help all Marylanders achieve their best health and a lifetime of wellness. Our meetings are usually held monthly. This is an extraordinary meeting in that we're here specifically for one purpose: to discuss our interim report and to ratify that report so that it is sent out in a timely fashion for our December 1st deadline. This is a public meeting. We have followed the requirements of posting a notification of this meeting. It is also being video recorded. By your continued participation in this meeting, you consent to this video recording. We ask that any members of the public who may be attending this meeting to mute their microphones during this session. This meeting does not include a time period for public comments. Today in particular, we're just allowing the commissioners themselves to be providing comments since we have a task ahead of us. And we won't be monitoring necessarily the chat function during the meeting. We encourage public comments to be sent via email to md.coph, maryland.coph, Commission on Public Health, so md.coph@maryland.gov. We also ask our members of or commissioners to also mute their microphones when they're not speaking and use the raise hand function if you wish to speak. There are attendance requirements for individuals appointed by the governor, and this is outlined in the state government article, section 8-501. So we'll be taking attendance not only to confirm that we have a quorum, but to make sure that we do have our commissioners attending on a regular basis. I'll ask Michelle Kong from the University of Maryland to conduct a roll call of the commissioners.
Good morning. When I call your name, please respond with here or present. Delegate Heather Bagnall,
Present.
Camille Blake Fall, Christopher Brandt, Nina Brewster,
Hi, present. Thank you, Michelle.
Jean Drummond, Senator Clarence Lamb, Matthew Levy,
We have a here from Clarence Lamb on the chat, so I'm not sure if he's
okay,
okay.
Present.
Alyssa Lord, Boris Lushniak,
Here.
Nilesh Kalyanaraman,
Here.
Olawatosin Olateju,
I'm here.
Fran Phillips,
Here.
Mara Rossman,
Present.
Nicole Rochester,
Present.
Michelle Spencer, and Alan Twigg.
Here. And we also got from the chat that Chris Brandt is on. He'll be on video in a minute. So we do have quorum, Michelle, is that correct?
Yes.
Okay, let's proceed with today's meeting. The agenda for today's meeting has been posted and distributed to the commissioners. The agenda is rather straightforward. As I mentioned, it really is first, having a key feature of us is reviewing and discussing the 2024 interim report. We thank you for all of your comments. We've had a process of addressing most, if not all of those comments, but certainly not all of them, and we'll have further discussions today. Ultimately, we'd like to put in a motion of adoption of this 2024 interim report with any revisions that are recommended by the commission. Therefore, I'll ask for if there are any comments on the agenda as it currently stands. Any comments from the commissioners? If not, I'll ask for a motion to approve today's agenda.
I move to approve. I move to approve today's agenda. Tosin.
Second.
Okay. Who seconded?
Maura.
Okay, thank you. And now let's put that up for all for accepting today's agenda. Please raise your hands. Okay. Any against the agenda today? Tosin, lower your hand. Mina, lower your thumb. And any abstentions? Okay, we accept today's agenda. Yesterday, as we sent out a package, Shane did a great job of getting things out to us, including the latest revision. There may be some other changes in terms of our interim report, but you should have seen the interim report with comments that are still out there, addressed in there. But we also sent out the minutes from the November 7th meeting, just to keep us in line of making sure that we approve minutes of the most previous meeting. The November 7th meeting minutes were posted and distributed. Are there any comments on the previous meeting of the commission on November 7th? There being no comments on that, I'll ask for a motion to approve the November 7th meeting minutes.
So moved, Maura.
Okay,
Second, Nina.
thank you. All those in favor of the approving the minutes, please raise your hands. Okay. All those against the approval of the minutes? Any abstentions? Okay, minutes from November 7th are approved. We'll now reach the portion of the review and discussion of the 2024 interim report. You should have received that report. I do want both, so to some extent, we're going to begin sort of this discussion, both in terms of an open discussion at some point, but also I want you sort of to understand what the process has been over these last few days of us putting together not only your comments, putting together the report, but also for us today to walk through any issues that are still outstanding with this report. I'll remind you that this report is mandated by the legislation. We had issued a report last year. And if you look at that report was very superficial because we had not even met as a group. It was an initial report basically saying, here's who are the members of our Commission on Public Health, but really had not much in terms of substance in it. One can be proud that a year later, we have this rather extensive report that really goes through a lot that has been going on. I just want to sort of put out there that this is an interim report. I'm going to reemphasize this time and time again. This is not the final report. From the co-chair's perspective, it has all the elements that we would like to issue in the report, including some of the issues that are totally not resolved. But in terms of part of our product going to the state legislature, it at least gives the legislators, and Delegate Heather Bagnall and Senator Lamb can comment on this from their perspective. Does it provide the information in terms of some of the issues that we are at least tackling? Once again, we are not at a stage right now of making any final recommendations. That's going to come throughout the course of the springtime into the summer and with the issuance of an October 1st report. So we're not sticking, in my view, sort of our heads out with any solid recommendations right now. What we're trying to do is bring up some of the issues and be as transparent as possible of what we've been talking about and what the work groups have been talking about over this past year. My other prelude to our discussion here is going to be a sense of if we disagree, that's great, right? At the end, as we talk things through, it's difficult for 16 commissioners to come to line and say, okay, this is definitely where we should be going. Right now, what we're looking for is to have this discourse, to make sure that, we are looking at the right things, that we are ultimately setting ourselves up for success with a final report that's really going to sort of, be an incredible asset to the state of Maryland. That being said, today's discussion should be vibrant. Today's discussion should be passionate. Today's discussion should lead us towards a sense of where we want this interim report to be. I'm going to ask Sarah to sort of get on line here and just discuss with us where the comments have gone, how it's all looked. And I think maybe we'll have Mina also add, because there's been some of the work that she's been doing in terms of addressing those comments. But please, Sarah, why don't you start?
Yeah, absolutely. Thank you. Thank you, Boris. And thank you to everybody who took the time to look through the draft that we shared and to provide comments. Really appreciate everything that everybody shared. It was very clear that people took the time to look very carefully throughout the report. And we have done our best to address directly as many comments that we could, especially those that are related to specific sections of the report. So for example, I know there's a suggestion to add in more information about demographics on Maryland that were over 65 years old, and any other comments that dealt specifically with any grammar or spelling errors. I mentioned those just to say that we are not looking to go through each specific comment during this time, but just to know that we did see those and try to address them. And if there are any questions about a specific comment such as that, please feel free to reach out. But we do not think that those all need to be discussed as part of the larger group. I would, though, like to flag quickly to reassure everybody that we have taken the time to look through the commission and work group rosters to make sure that those member lists have been updated. In the version that was sent out, you may still see that there are some formatting issues. We will resolve those as we move forward in the report. But we did just to acknowledge that and make sure everybody knows that we saw that those need to be updated and apologize that they were not updated in the earlier version. We also did add, just for your knowledge, the list of presentations from the monthly commission meetings. We have the list of those presentations as well as the speakers for each of those presentations. So just adding that as something that you maybe did notice in the version that was sent yesterday that had been updated. It's just in a bullet list, and that should all be correct, but please feel free to look through and please let us know if there are any issues with that. I will also let everyone know that Mina has been working very hard to address some of the specific comments as well that you maybe saw in the latest version. Some of those comments that were still left open-ended, Mina has been addressing both this morning and yesterday. So I'm sure she'll speak a little bit more about that. But that's just sort of a quick refresh from my end to let you know that we are doing our best to address each of those comments. And please let me know. I am happy to speak more about any of those specific comments that anybody has any questions about. I will, as we go through this discussion, at times share the screen so we can look at any section together. But I will, for now, sort of put it back to Boris and Mina to talk a little bit more about some of the larger themes and issues that we were seeing as we were looking through those responses.
Great. Thank you, Sarah, for that brief overview. And in addition, those of you who do have double screens, it may be helpful not only to have it like I have on my screen right now, all of your pretty faces is on one screen, and then I have the document open on the other screen. So Sarah will be bringing up the document as we have discussions about specific sections so that we could discuss this through. I'd also at this point and, sort of put out a shout out to, everyone who did comment and the commissioners and work group chairs and others who provided comments along the way. In addition, the incredible support and teamwork that we're getting from the CDC Foundation on this, that we did have, an outside writer assist and provide the initial, drafts of this report. We're also, looking at the graphics being arranged too, and so this at the end is going to be a product that I think we'll all be proud of. I'm going to set the microphone first for further discussion to Mina, and perhaps we'll include Fran at some point because there's two components, Mina, here that I'd like you to cover. One is just sort of the review of some of the comments that you've been conducting, but also the inclusion of the preface to the report, specifically dealing with the AHEAD model. And I know that was coming from both you and Fran. And so, Mina, take it away.
Thank you. And Sarah, I just really want to start off by acknowledging Sarah and Shane and Dushanka, Megan, so many who've been working behind the scenes on this report. Of course, working with outside contracted help, but also putting in a lot of their own time, effort, and proofing into the process. So thank you all who've been involved from that perspective. I do want to, I do think it would be helpful because I know the 16 commissioners and work group co-chairs have received the interim report draft, and the commissioners in particular received the most final version that we're considering today. But it might be helpful, since we have other members joining in to follow along the discussion, if Sarah, if you shared, screen shared the current version that includes some of the draft comments and so forth. So Boris, you asked me to cover two things specifically, just kind of or introduce the topic of the larger comment themes, and then to talk about really what Fran, Chris Brandt, and I worked on together a little bit, which was a proposed preface to the report that responds to some very significant and time-sensitive proposals from the HSCRC related to Maryland's AHEAD model. If okay with you, Boris, I'll defer on the preface, and maybe that's something Fran can speak to a bit more, and then dive in specifically to a couple of the theme comments that came up or across commissioners. But I know Nilesh also brought this up, so if he needs to speak up and add to that, please go ahead, Nilesh, and contribute there. So one of the comments was really making sure to reiterate that the scope of reiterate really what you were saying before, Boris, which is where we are in the process. We're very, very early in the assessment process. We've had a lot of help from an incredible assessment team, but those elements of the assessment are still underway and have not been considered. The results of that have not been considered by the work groups in some of the framing questions and some of the early thoughts or emerging thoughts that have come out from the work groups. So there are some language. There were some concerns raised about how this report is put forward, and if the language that we're using in the report is emphasizing adequately enough how preliminary our emerging thoughts are. And so, Sarah, if you go down to where it says the framing questions, and then after that it has emerging themes, there's a comment put into emerging themes, hopefully that adds a little bit more language to, again, even though it's stated earlier in the report, to restate how these emerging thoughts are preliminary, the early stages of the assessment, that the final report will have much more robust assessment to inform its thoughts, recommendations, findings, however we describe them at that point in time. So I'll put that out there, that there is some language that was put in here since the draft circulated yesterday evening, just to reiterate that before we launch into some of the assumptions and emerging themes that the work groups have put forward. Secondly, there was some additional language put in throughout the report, particularly in both the framing questions section, as well as in the description of Maryland's public health system and governance, that ensures that anytime that we're referring to health departments, we're really referring to both state and local health departments. That the language, when health departments is used as a phrase, just because there's 24 local health departments and there's one state health departments, some people may think more of local health departments in that use of phrasing, but really health departments as a phrase is inclusive. But to be explicit about that, and to ensure that we are explicit about that in the report, Sarah, I know you worked on adding in some language, and I did as well, to ensure that we're referring to health departments as state and local health departments. And so there are various places of the report where that's been corrected since the draft circulated last night. I think there were additional comments around the description of the 24 local health departments and local health officers. So there was some clarifying language inserted as well to respond to that comment. So that I'll just put that out there, those general comments. I know that was included in the email last night that circulated the report. Boris, if you have anything else to add, or Sarah, I think that would be helpful. And Nilesh, of course, I know you originated some of those comments, so I wanted to give a chance for him to speak as well.
So I'll bring Nilesh on shortly. I do want to go back to that initial beginning. So we're going to make you jump around a little bit, Sarah. The other component of this, Sarah, is I'm not sure if it's helpful or not, and whether you can multitask on this. But is it worthwhile sending this latest version to email it to the commissioners, or is that too much of a hassle? Just so people can view it on their screens. If not, we can go through this, but let's figure out sort of process on this. I do want Fran and Chris to sort of discuss their approach and their submission of the preface in particular, because that is a big component now of the lead-in of this report. As mentioned, this is sort of a just-in-time modification because of sort of changes that have gone on just recently. And Fran, do you want to take it away in terms of your thought process and why it's important for our commission to include this preface?
Yeah, sure. Thank you, Boris. And this has really been a project, as Mina said, that Mina and Chris Brandt and I have sort of spearheaded, but we've gotten a lot of input from other commissioners and work group members or commissioners. And to that end, I don't know if she was recognized at this point, but we have a new commissioner online who is Dr. Lucy Wilson, the newly appointed health officer for Baltimore County. So welcome, Dr. Wilson. It's great to have you. So yeah, this preface came about, or this sense of appropriateness of expressing comment on behalf of the commission, which we certainly will discuss here, and all of this being draft, and hopefully conclude the discussion in a motion to approve. But the timeliness of this opportunity was one that was presented when the staff to the HSCRC released online draft recommendations for how to go about the implementation of the new AHEAD model. So that draft was just released November 14th. It's online, and we can certainly, I guess, I don't know if the link is there or not, but we can get it to you. It's online, and to our mind, it represents a really extraordinary opportunity to build a new infrastructure, by which there can be meaningful resources and collaboration between acute care, clinical medicine, as well as public health prevention and population or community-based approaches. So the urgency is that the draft recommendations were released. Comments on that draft are due in 1 week from today, the 27th, and on December 11th at their next meeting, HSCRC will take up this matter. There will be a public hearing opportunity for presenting oral comments, and there will be a vote on the recommendations as presented or perhaps as modified. So what's it all about? Well, staff in the HSCRC, they've got a lot of financial wizards there who monitor the overall total cost of care in Maryland relative to the targets that were established by CMS. And in large part, those targets are not just about Maryland's year-to-year spending growth, but our spending growth relative to that of the national average of other states. And for reasons that the staff goes into, but I won't hear, we are way ahead, or I should say way below what the national average is in terms of both inpatient and outpatient expenditures in this last year. And that's really good news. There's reasons for that. But what that means is that there is an opportunity right now, this year at least, for a modest increase in our hospital rates across the board. Remember, this is all payer. So a modest increase in the hospital rates, but still keep below that target for growth. And that's what this proposal does. It recommends an increase of 1.6% in the hospital rates across the board. 1.6%. Well, doing the math, that yields about $20 billion. I mean, this is some serious money. The overall spend is $20 billion. The 1.6% increase would yield about roughly $320 million this year of additional revenues. The staff is proposing to do two things with that additional money. Number one, 80%, about $260 million, would go to support resources to support clinical innovation, similar to what's been going on in hospitals, but to extend that to outpatient settings, extend that to primary care, to FQHCs, to other types of non-acute clinical settings in order to bring about the kinds of reductions in costs, but very importantly, improvements in quality and outcomes, as the hospitals have been recognizing. 80%. 20% of that increase, which amounts to roughly $60 million in 2025, would go to a newly established independent population health trust. This is an entity to be defined, and a lot of the structure around this would be articulated by the legislature, but it would be a new resource, a new management entity that could accept both public and private resources in order to expand the kind of work that actually the state committed to in its agreement with CMS, its final agreement for the AHEAD model. So the kinds of work that this population health trust could promote, and really must, in order to meet targets, must promote, would be things such as reducing the rate of preventable health conditions, increasing healthy habits, addressing health-related social needs, reduce or eliminate health disparities, or build evidence of effective prevention programs. So all of that sounds like public health to me, and really an unprecedented opportunity to develop this infrastructure, even if it should come to pass that in future rate years, this kind of marginal difference that the state could invest in the trust. If that goes away in out years, it goes away. But at this point in time, it appears that there's an opportunity to at least establish this infrastructure and to go forward with it. So given the timing, we thought that it was important to put this on the table to the commissioners right away in order that we could offer some comments to HSCRC, hopefully comments to endorse and approve those recommendations, and to move forward. So there's some reasons that we thought were pretty compelling that are outlined in the preface itself. I won't go into all that, but that's a little bit of the background about what it's all about.
Great. Thank you, Fran. Chris, I'm not sure. Do you have anything else to add? I know you were part of this group as well. Chris?
Just one gratitude to Fran and Mina for their leadership here. But also, I mean, just enthusiasm for the opportunity in front, that's immediately in front. I mean, the public health work is hard to get funded. Increasingly, the hospitals are very much a part of the public health infrastructure that I believe is very much relevant to what we're doing here. And I think there are opportunities to align with the hospitals that have very real infrastructure and professionalized management. And as evidenced by Dr. King and his presentation last meeting, a lot of passion for and alignment with our goals in moving the needle on health equity and public health in the state. So I just want to make sure I think we should use this as an opportunity to absolutely support this bill, but continue to, or this whatever it's called, the recommendation by the commission, but also to just further engage and look for opportunities to carry some of the water for the hospitals to the extent it aligns with, it helps them help us in terms of achieving some public health metrics, and then hopefully they'll do the same for us. So
great, thank you, Chris. We're going to open up just this component of the report, since this is a new component to our report for discussion amongst from the commissioners. Does anybody have any questions or any clarifications or any point of discussion on including this preface to the report?
Sorry, Brian or Boris, just wanted to call attention to the version that was circulated. I had a suggestion under the bullet point about GME action, which I think Sarah's on the next page. I just tweaked the language a bit well, actually, maybe it's the one after this. Yeah, there we go. Just to clarify that we're talking about primary care residencies because GME dollars are specific for that. Well, specific for residency training, I should say. And that to add in the word training programs as well as practices, because the GME dollars support the training programs, not necessarily the practices themselves,
Right.
unless they're
Thank
for
you,
training
Dean.
programs.
Right.
Mhm, sure.
Great.
And then deleted the extra Marylanders in that. Otherwise, that's all. Thank you.
And Shane, if you can assist me with any raised hands, because I'm sort of multitasking here. So if there's anybody out there, let me know. Just shout it out if anybody has a raised hand. My intent with this is that I want us ultimately to vote on the whole interim report as it is, as opposed to going by section by section. My intent right now as part of our agenda is to go to areas where people have provided comments and allow them to sort of expand on those comments. So if there's no further comments or discussion of this preface to the report, and I see none on my screen. Anybody out there, do you see Shane or not? Okay, Matt, you have something. Yes, Matt.
Yeah, I don't know if this is a good comment or not, but and I just now, sorry, looking at the preface, even though this is an interim report, but the final comments for the head model are due before December 11th, right? So is this at all reflective of our comments to the commission? And if so, I don't know if the commission can't, I don't think, put in comments, but in this indirectly we do. And if so, do we want to put any kind of stronger language? I think this is great, honestly. I would only suggest that maybe we have a little bit stronger language around supporting or the public health system directly through the population health trust. It sort of dances around it a little bit, but is making recommendations around the population health trust to support statewide population health improvement initiatives. And I would add, and the public health system. If these are the recommendations, I don't know if these are coming out of the report, so I'm probably talking out of ignorance on this. But I think the other thing I would also add is that I don't know if this is relevant to it at all, but health departments do a lot of care coordination and case management, and link people to are an ideal spot to link people to other services, social services, hospital systems, healthcare systems. So you might want to call that out somewhere. So I don't know if that's is even a relevant comment, but I feel like we have an opportunity here to really carve out a way for us to sustain public health infrastructure to the future using some of the funding that they're proposing. And I want to make sure that we have enough clear language to make that unequivocal.
Fran, any comments on that?
Yeah, thank you, Boris, and thank you, Matt. You really kind of moved the conversation forward a little bit to where I wanted to go, but I paused for a minute, which is to say that, first of all, yes, this the comments are due on this proposal to HSCRC next week, and our report won't be out until December 1st. So that's a missed opportunity if the vote happens a week before we issue this report and have those comments. So in another action that I hope the commission now will take up today, or maybe not right now, but would be to approve forwarding comments directly to the HSCRC in a timely way prior to 11/27 when they are due, so that we can actually go on record as a commission with regard to this proposal. So I guess that would have to be a separate motion, and we haven't drafted those comments yet, specifically to the in the form of testimony to the HSCRC, and perhaps also oral testimony. So that thank you for kind of bringing up that other piece of the other shoe to drop. I will say that thinking about the audience, the commissioners who are the HSCRC body, with perhaps one exception, the chair, I think most of them are pretty uninformed about exactly what local health departments do. Okay, fair enough. They're coming from a different part of the universe. But what they are very informed about and very committed to is making damn sure that Maryland meets the performance targets in the new AHEAD model. And those performance targets aren't easy. In fact, they will be impossible if hospitals don't reach out to local health departments. So I think the approach to the commission, to HSCRC, our approach to that commission, is not to say, oh, this is a great resource for our local health departments. That's not what they're going to be sensitive to. What they're going to be sensitive to is the gentle assertion that this model will not be successful without the work of local health departments and other nonprofits in a community-based approach that is far beyond the capabilities of Maryland's hospitals. You see what I mean? So I think that's a little bit of a nuance. What I think would be really valuable, it would be to tell a few stories to the commission very briefly about what a couple of health departments have done, evidence-based prevention programs that have yielded results. That's what they are attuned to. They are so anyway, kind of getting beyond that, but I guess I'd turn it back to you, Boris, how you would like to procedurally have the commission weigh in on not only the preface, which is the language of this larger purpose of today's meeting, but also hopefully approve or vote on issuing testimony, either written or oral or both, to the commission next by the deadline.
Yeah, I mean, from my perspective right now, Matt, if there's any, recommended changes you have in the current language that makes it stronger to get to your points, then do submit them now, right, as sort of recommendations to this report. Otherwise, when we vote, at near the end of this meeting, we're going to be voting for the language as is accepted. And what we don't want to do is necessarily have too many versions going out. I think there's a two-step approach to this, one of which is, the fact that we're mentioning this in our preface right off the bat shows its critical tie-in with our own commission's work, right? So that's part of it. The next is our further communications, whether as individuals who are commenting or as a commission who comments. We can sort of discuss sort of a path forward on that, even though there are time constraints on that. And maybe I'll put it back to Fran and maybe Chris and Mina to think through, is there anything that the commission can do in terms of a submission that we can get out? Again, the issue, of course, it becomes procedural. How do we get something out from a commission when the time is ticking, right? But I think, the value added of this preface is this is critical. This could be a game changer, as both Fran and Chris have mentioned, and one that, it gives us an opportunity to highlight it. So.
Can you scroll up just to number 4? So I'm looking at probably an old. Oh no, number 4. Oh yeah, so you added more to that, to the bottom of that, than the most recent one. The creation of no, sorry, go scroll down just a tiny bit.
And I do believe, and Shane, I think Shane did just send out this latest version to everybody's emails. So you should have the same version that we're looking at right now should be in your inbox.
Yep, I just got mine, so that's great. Thank you.
Boris, Maura has her hand up as well.
Maura, go on.
Thank you for that. Mina, thank you. I had a comment about the more inclusive primary care. Thank you for that. I'll be very brief. I do think, Fran, what you just articulated, I don't know if it's appropriate, but there's a lot of funding at stake, and I didn't see that explicit in the in this first document, whatever we're calling that, the thing about the ahead. I think that's really important. And two, maybe this may help with Matt's comments. The term chief health officer as chief strategist is used frequently throughout the document, but I didn't see any definition or description of what that meant. And I know there's some, you can quote Auerbach or some other, and I think that may help explain the connection between the health officer or LHD and the population health goals in the AHEAD model. Just again, trying to be more explicit to the readers of this document who may not really understand what LHDs or health officers do. And then the last comment is whether or not it's in this or throughout the other document is defining or explaining better the relationship between the state. I know we just said that a health department is defined as both the state and locals, but what is that connection? Because the funding may roll through the state health department, then to the local health department. So again, explicitly what that relationship, what's the vision for that relationship? So thank you. Well done.
Great. Thank you, Maura. Matt, you still have something to add there, Matt. Go on.
Just one last. So I think, Fran, I appreciate your comments on that, and it makes a lot of sense. If I were to add any language into this, I think in number 2 on 4, 1 and 2 on 4. Sorry, on 4.2, a population health trust that support statewide population health initiatives. Something like which the public health infrastructure is a critical and necessary element. It's probably semantics and it probably doesn't matter, but I feel like we need to keep calling it out keep calling it out in a very clear way. And maybe this is my first read of it, so probably I'll have to go back and read it again. I thought you you wrote this is amazing. How you wrote this. That would be my only suggestion. And I'll leave it to the group to decide if that is even worth it.
Boris, Tosin has her hand up, but if it's helpful, maybe Sarah could capture that language and as Matt was describing it, so we can look at it on screen as well.
Yeah, give me 1 second. I may have to stop sharing for a second to get this document editable, so I'll stop and then reshare.
Okay, thank you. Tosin?
Yeah, I just wanted to ask, are we adding a table of contents? It just came to my mind. I think we can benefit from that. If possible, before the preface. That way people can, because we risk people seeing the preface, and that's going to go into my second comment. The preface is usually kind of like a summary of, really what the entire report. We risk having the readers think it's really about the AHEAD model. Sorry, I lost my voice. Thank you. So I would maybe integrating some of Matt's comments and Fran's comment, maybe a little bit more summary about a little bit of the report, what the report is about, maybe 2 bullet points, so that the preface is not just solely about the AHEAD model. And we have some of those languages within the body of the document. I just don't want the preface to be about the AHEAD model and then the readers just right off the bat think our report is about AHEAD model.
Okay, thank you, Tosin.
You're welcome.
Sarah, you ready for us there or not? Okay, 1 minute. Our next, if any more comments on, Mina, you have a comment?
Yes, thanks. Just to respond, I think Tosin made some excellent points. When it comes time to approve, whatever version we do approve, I'm just tracking some of the amendments that we can include in our language of approval. So far I have adding a table of contents and an introductory paragraph or version of an executive summary prior to the preface about the AHEAD model, right? So that the TOC and the table of contents and the executive summary / paragraph, right? And maybe it's not a full executive summary, but more of a short executive summary would be really about the task of the interim report, and maybe then introduce at the end the preface, and then allow the preface to continue on, and then the sections of the report.
Okay.
And then I heard from Maura the amendment of needing to define in the language of the report what a chief health strategist is, and perhaps by referring to John Arbuck's articles and so forth on the topic. So that might be a paragraph where we start talking about the public health system and describe the system. Maura, I know you added in some other thoughts as well, but maybe that's you could resurface those when we get to those sections of the report where they become relevant. Is that all right? Okay.
Great.
Thanks, Boris, for allowing me to just
I think that'll
summarize.
be great. And so when we vote, it'll be with those, we may not have the exact wording there, but we'll be voting on the idea of placement of both a table of contents and a short intro prior to the preface, and then we get into the preface area. So we'll take that into consideration, that'll be built into this. As we receive multiple comments, we're not going comment by comments. We want to make sure that people who are our commissioners who are on are sort of following this latest version. But one series of comments we did get that we wanted to further discuss have come from Nilesh and Sarah. It strictly goes to, let's get to section 3.2 and then ultimately 3.3. And I'd like to hand the microphone over to Nilesh at this point. Nilesh.
There we go. Thank you, Boris. So did have a few comments. I know that they were shared via email, but I'm happy to expand on them. So a couple of thoughts that I had is one, after some discussion, I think I get where we're going on this, but the framing questions in 3.2 around health departments typically refers to local health departments, right? Because there's only one state health department. I know opinions vary, but for precision of language, if we're going to say that, then we should be really clear about when we're lumping local health departments and Maryland Department of Health in, and when we're separating them. And so I think I haven't had a chance to look at the updated version in detail, so I'm going to just put that comment out there, and maybe it's been updated.
You can see on the shared screen is, I think, the updated version, taking that into account in the 3.2. So if you have it on, you can see that I think the purple is the new language. Is that correct, Mina?
Yes. That's some of the language, but then it was also corrected. I think Sarah went through and added in state and local in front of the phrase health departments throughout the document.
And registering that change, good. I think that offers clarity to what.
Right.
To what
and I think this is a critical piece, Nilesh. I'm glad you brought it up because, ultimately, as we've had this discussion, is that, we want to make sure that we are looking at the whole, public health infrastructure of the state. And obviously that includes the 24, but it also, doesn't, exclude. In fact, there's an emphasis on, the state health department in this. And we have to make sure that we are using the right, both lexicon as well as the spirit that comes out of this. So thank you for that.
And I think that was, I don't want to move past 3.2, but that was my commentary on that.
Okay. And so let's move to 3.3, which are the themes.
And this one I had a little bit more pause on, mainly not because these themes are inaccurate as having been surfaced. Just as I see them, they are in various stages of maturity. Some of them will blossom to become recommendations. Some of them may morph. Some of them may die on the vine. And I think in an interim report, we're capturing a snapshot of a moment, and this moment is not. I struggle with codifying a moment in time that is still evolving this much, and that really gets to the core purpose of what we're trying to accomplish here. And so I have deep pause about this in terms of putting these out. I understand putting caveats that we're in a moment of time and all that kind of stuff, but I just want to be alert to the reality of how people read reports, and that you can put caveats, but people gloss over caveats pretty frequently, and textual analysis after the fact isn't the same thing as not putting preliminary findings or preliminary themes as being representative of where we're going to end up.
Can I just ask, what's the downside of having people to ask questions or talk about something that is it's a legitimate snapshot, even if we end up letting something die on the vine, or what's the downside of this?
The downside is that the people who are going to be reading this are looking at this as a reflection of where we're going. And I think we have a responsibility to accurately reflect where we're going. If people want to join our meetings, they can, right? It's an open meeting, but the report represents a specific, we are required to, as a commission, we are required to provide an interim report, right? And so I think it has to be able to portray an accurate synthesis of where we are and where we're going without settling on ideas that haven't been settled.
Yeah, and I think to a large extent, I mean, this is really sort of the brunt of this whole section, right? You know, I have a comfort in that they aren't settled, and I have a comfort in this issue of, you know, sort of putting forward the idea of, you know, what have we been talking about? And I understand the danger, nonetheless, that people will jump to conclusions saying, well, this is where they're focused. I think this, at this point, is both the working group, you know, endeavors as well as issues that have come to the forefront. So, you know, it all depends on our comfort level and what we want to do as a commission. Senator Lamb, your hand is raised on this. Go on.
Yeah, thank you, Dr. Lushniak. You know, as the Senate
Clarence
sponsor,
and I'm Boris. I'm sorry, I just broke the rules, the Parkin rules. So Clarence, you're on.
All right, sorry, Clarence is perfectly fine. So, you know, as the Senate sponsor of this bill, I think, you know, in looking back at how we came about and the provenance of the provisions of the bill that led to this commission, I think these types of recommendations, even though they are interim, even though they are a snapshot in time, and even though, you know, they're you know, may lead to some discomfort, I think this is actually really helpful, and this is actually the intent of some of the you know, crux of the point of having an interim report, that, you know, this is a snapshot in time. We recognize that, but it also gives us an ability to look forward as a legislature to see what we can do moving forward at this point in time, that there is no point in waiting, you know, another year for a final report for this to you know, solidify or to change in some way. I think, you know, we recognize that it's a snapshot in time, but we also recognize that we have to start somewhere, and that somewhere is where we are now. And, you know, as much as, you know, public health is imperfect, and we all recognize that, you know, it's a work in progress. And, you know, we have to meet people where they are and start from where, you know, the reality is. And I think that is here. So I think there is value in keeping these recommendations in here.
Great. Right. We're focusing them as themes and not necessarily recommendations. It's the beginning sort of status of you know, of what are going to be final recommendations. Other thoughts from commissioners on this approach?
You know, I think there's validity to everything, of course, being expressed. If it's helpful, even though we've used this language previously in the report, it might be helpful at this point in time in this subsection of the report to reiterate the preliminary nature of the thoughts, right? Maybe we change the word, as Dushanka recommended, from themes to some other word. She mentioned issues. We could say thoughts or something like that. But it might be helpful to reiterate how preliminary we are right now at this stage and what components have actually been completed, yet what components are to come of the assessment. And so if we wanted to, we could take some of the language, I think we had in a prior section about the depth of the assessment at this point in time, and maybe restate it in this before we get into 3.3.1.
You know, there is under Sarah, can you scroll up to 3 right before 3.1, just 3, because I think there was some additional language introduced in yesterday's version. Right there. No, I'm sorry, 3 point, yeah, just scroll up to 3. Does that reflect, you know, here we're talking emerging thoughts. So the question is that really the emerging themes? And, you know, do we change the word of themes to preliminary, you know, emerging issues? Or, you know, emerging means that something is in flux already, right? So emerging also means that these are acute, you know, emerging infectious disease, right? It gives us a sense of, you know, things out there. So maybe it's you know, it's wording that we want to make sure that we're getting. Any comments on either this additional language in 3.0 or how we term the what we're calling right now emerging themes?
Guys,
Okay, Chris, I see your hand up. Chris, go on.
Yeah, I would just like I would just caution us towards retreating anymore. Like there's some really brilliant people around the table that know a lot about public health and the situation, and maybe Senator, maybe Clarence, you can help shine some light on this. It's not good. Like there's everything is going to be called into question in the budget. And like and it worried me, a comment I think Fran made talking about the HSCRC is like, well, they don't even know what public health does. And you know, it makes me, because I have a very limited understanding, who's been in healthcare for a while, understanding of what health does. And so like I do, over this next year, we sure that we can all of the understand and defend all of the different programs that we're doing and talk about how they tie into that state health improvement plan, those metrics and the health equity metrics that I think everybody will rally around. But I definitely want to caution against more retreat language, more, well, maybe this, maybe that, the academic sort of approach, and get real both strategic and tactical about you know, where our resources are, where our strengths are, where our weaknesses are, and where is the biggest bang for the buck in the work we're doing.
Great, thank you, Chris. I do want, for this language that's put under 3.0, I'm not sure who submitted that. Was that you, Sarah, or is that from Mina or somebody else? But I guess does emerging thoughts as listed here equal emerging themes? And are we confusing the audience by you know, several aspects here? There's a quote unquote emerging thoughts. Mina, go on.
Boris, that was me, and I'm sorry. I was, as I was writing that, I was kind of keeping Dushanka's comment in my mind of it might be we could consider changing the word themes, but we can change thoughts back to themes in that new language to be consistent.
Okay. Yeah, I just want to be consistent whatever we decide. Matt, you have a comment?
Yeah, as I read these and reread these, they feel more like deficits, things that we're not doing, most of them. Like this is not here, this does not do, you know, state management system does not. And while these are themes around deficits, we don't really talk about strengths, at least not in this section. And I don't know if that changes the title at all, but it feels more like these are the things we've discovered thus far that are missing from our public health system, or that are causing us to have lots of challenges. It doesn't really talk about strengths very much. So I don't know if that changes how we look at this, but that's what it feels like to me.
Yeah, and my retort to that, Matt, is don't forget that the purpose of this commission ultimately is to come up with recommendations, right? I think we'll have the opportunity, in the final report, and even in this report, we talk about sort of, the infrastructure, we talk about what we've learned about public health, et cetera, et cetera. In the final report, I think we'll have the ability to say as well, what's working, certainly in the introductory paragraphs. But ultimately, the goal of this commission is to come up with recommendations. And recommendations oftentimes are going to be focused on stuff of improvement, what doesn't work, as opposed to spending time of saying, okay, yay us, this is what's working. The yay us will be, I think, in the final report saying, okay, people, let's realize, where do we stand nationally? How are we doing things, et cetera, et cetera. But right now, I think the focus is ultimately going to be on not the negatives, the deficits, but how can we sort of shoot for improvement? Mina, you have a comment on that.
Thank you. I was just responding to, perhaps we should consider the comment that Dashanka had already made, which is changing the word themes to issues. It's not a retreat, it's semantics, but then it may reflect better the tenor of the words that follow it. And so if we replace the word themes with issues, and where it says emerging thoughts in the revision, we replace that with emerging issues or something like that, maybe that captures some of the, that might bring us a little closer to consensus.
Tosin? So the suggestion is to basically discuss this section as emerging issues. We view it as not a retreat, Chris, but things that have been brought to our attention. Tosin, anything else?
I think we could either leave it as it is, but redefine, as Mina had suggested, before the themes, reiterate, what the themes are. I think just, a brief of that right before it would do. Themes, issues, it's really all about us specifying what the intention is. And as Boris said, we would have the opportunity to elaborate more on some of the strengths, right, that Maryland has in the final report. Again, going back to the purpose of this report is really to describe our process thus far, the works of our work groups, all our engagement. So we really have to be mindful of that. This report is not really, it's just really describing what we've done so far. So again, I think a little description right before the themes for each of the work groups would do. Or if we want to change it to issues, that's also fine. Yeah.
Okay, I'm gonna, since the comment came initially from Dushanka, she's not a commissioner, but she's been working on our leadership team. And Dushanka, any reflection on your suggestion of using issues in there?
I was using that term mainly because of where we are in the process. Mm-hmm. And also the fact that we received these comments from the work groups, and so brought them forth to the commissioners. And obviously the commissioners have been involved in the different work groups, but we wanted to stay true to the discussions that came from that very broad input. And so these are still incubators, let's just say, phrases, observations that have come forward, but I think they could be reworded as assets. These are issues that actually have the ability to allow us to build on a strong foundation that's already there. So we may be able, with some minor editing, even to take some of the issues that are listed here and build on the fact that they could be more specifically articulating, for example, our increased understanding of the public health system and its functions in the healthcare continuum is needed. So we have an established system and a foundation, but that articulation is needed. These are positive comments. So It's sort of a combination, but issues to me is a much more reflective term of where we are now. And it also recognizes the work that the broader work groups have done and where we are in the process.
Okay, thank you. Thank you, Dushanka. So my suggestion as another amendment to as we vote on this report is to substitute the word issues where we have themes. Okay, discussions. We sort of went through two of the main areas, the preface and 3.2 and 3.3 that we've discussed. Going back to the commissioners now, prior to any motion regarding this report, the floor is open for any other sections.
Boris,
I
I want to note that Maura made a comment that on page 5, she suggested adding more description for the role of the Secretary of Health and the relationship between the Secretary and the LHDs.
Okay, let's go to page 5, if we would. Sarah and Maura, you're on. Anything to add to what you just said?
No, it's precisely that. I just think the role of the secretary gets a little short shrift. What does it say? It oversees programs. I mean, I think the secretary does more than that. And if we're going to give a little more detail to what the chief strategist does, I think it is important to call out what the Secretary of Health is and the relationship between these two public health entities.
Okay.
Just to ask for clarification, Maura, the next page does talk about after it goes through the state entities, so the Maryland Department of Health, and then it goes through, if you go past that section, Sarah, well, I was recommending we shift the MDE paragraph to this level because we're talking about state, and then go into the local health department's area. But underneath that, it then talks about the authorities and the delegation of authorities from the Secretary of Health or the Secretary of Environment to the local health officers. Is that what you mean by describing the relationship, or is there some other way?
That may qualify it. It's a lot. I mean, I read the document and I sort of missed that. But I do think we should call out again the role of the secretary, how it's different than the role of the health officers. And again, it's not just that's for the group to decide. Is the relationship strictly structured on the legal authorities, or is there more of a relationship? The reason why I bring that up, because I do think in light of the AHEAD model, which is being spearheaded by MDH, that we should think about, maybe not for this report, but think about what that relationship is, because if the Secretary of Health is the one managing the AHEAD, or whatever the right word, and working with HSCRC and the other health care entities in which we, local health, believe we play a big role, then spelling out that relationship is important. And maybe it's visionary, what we think the relationship with is. Anyway, to me, it just wasn't clear. And if we want the readers who have less information than we do, a sentence or two, I think, is important. I don't know if Nilesh has a comment on that, since it's really about MDH.
Anything from you, Nilesh, on that?
Not really.
Okay. Yeah,
not without knowing what it is that we're trying to get at.
Can we add that sentence now, just so we can sort of have a sense, or
so just to clarify, it sounds like this language here, I would be concerned about adding in language about the relationship that is in addition to what we have already in this version, because I feel like we're not going to have enough time to review that and put that forward. But I do think, Maura, the statement you said about giving more language related to the Secretary of Health might be helpful. And if that's the case, then the previous page, Sarah, if you scroll up the previous page where it starts talking about the Secretary of Health, or maybe it's the one previous to this, sorry. What if that would I think addressed your concern, Maura. What specific language could we add about the Secretary of Health after the statement that introduces that role?
I sent comments to Sarah, and let me try to retrieve them. I don't know if they went through. I was being specific, like, and again, specifically, the secretary has, I don't know, oversight to the hospital. What I would be more specific than overseeing various health programs, policies, and then I would put a sentence or two specifically what that means. Overseeing the financial whatever of CMS. I mean, just to understand that. 2 or 3 things. I mean, that's just me.
Okay.
You know, the overseeing of and I know that we report to NALASH, but I'm using that as a proxy, right? We also get funding and the prescriptive programming that we do from MDH, and that's really coming from MD, you know, the secretary. That isn't necessarily in the authorities.
Boris, I would ask if you have that a specific statement or two to add, that would be helpful to consider. If we're going to get to some type of consensus on the document, the other thought is to table it for the final report.
That's fine.
Maybe go into more depth on the role of the secretary.
Sarah, are you able to see my comments from this morning?
Let me look and see if I have that in email.
Thank you. Thank you.
Thank you.
Okay, so Sarah will look at those comments and introduce them if appropriate, not for appropriate, if she has them. The next sort of item here is sort of open discussion on the report in general prior to me asking for a motion. So this is now the open forum. Chris, you have something? Yes.
Yeah, I would just in the last section, the next steps and the analysis of preliminary data is I would just encourage us to use this opportunity to try to get in front of the pressure, likely pressure in this case, but even setting us up for good, you know, potential economic growth in the future and good, you know, good times, but like a real self-assessment of, and I know that's part of our mandate, but like really self-assess the capabilities, particularly of the activities of the local health departments and the state health departments, partly for inclusion in our final report, partly for education purposes, because like, I mean, like I, for one, should be able to talk about the activities of the public health departments with confidence and sort of a relative level of sort of budget. What are we spending? And then what are sort of the outcomes associated with the work. And like, I'm worried that like, that it's just not communicated. Like and you know, I don't know that much about what education is doing or anything else, but it would be great, I think, and I think it's in the mandate of this group to like have some of that. So it's just you know, sort of the magnitude of the different programs and the sort of how those tie into our state to the key metrics that hopefully are associated with the state health improvement plan and the health equity plan.
Great. So is there any changes you would make to this other than that sense of a realization of where we're heading as next steps?
Just one or two sentences, probably in that section of the analysis of preliminary data, just this self-assessment.
Okay, once Sarah's done with this section, Sarah, are you done with Maura's comment?
So yes, so I have just cut and pasted here on the side. I think the question and why I haven't just put it directly into the text was just in a clarification of sort of this blank spot here, the oversight of XX, and just we would need to decide exactly what wording we would want to put there, if that makes sense. Otherwise, I think it's all pretty clear and can be directly put in with just a couple just it can all just be put in with a little bit of clarification.
You okay with that, Maura?
Yes, thank you.
Okay, let's move then to the Chris, cite what section you want to look at now. It's near the end, Sarah.
Section 4, next steps. Either in the analysis of primary data or a new section, basically saying we're going to do a assessment of our existing infrastructure, sort of outlining, the very budgets of the state health department and the local health departments, and sort of like the key, like at a high level, programs, outcomes, or programs, activities, outcomes, something like that, so that it's clear that if somebody goes and tries to slash funding for something, they know what the outcome is that's going to result. Does that make any sense? Or if they want to add funding to a program, theoretically, you'll get more of the outcome to this. I hope this is clear, but it's basically assessment of existing infrastructure at a high level would be one of I think it would be a valuable next step. I think it's in the mandate of the commission as part of our final report. And I'll leave it. By the way, I'm an outsider and I trust our chairs and the wisdom of the crowd on this. Like I'm suggesting this, not. So it's just a suggestion.
Okay, thank you, Chris. Any thoughts on that?
Yeah, actually, in the spirit, thank you, Boris, and thank you, Chris. And I think in the spirit of what Chris is trying to say, I'm wondering if that might actually come as an emerging issue that is not necessarily generated from the work group content that we've received, but really from this commission, if the commission agrees to it, that a statement or something to the effect that Chris was describing of investment translates to broader outcomes, and that compromising investment in the public health system will then compromise the outcomes that we're all seeking in Maryland together. So I mean, that's maybe that's inferred perhaps by all of us around the table, but it might be worthwhile for us to identify it, if either in this section or under emerging issues or wherever it could be garnering that kind of attention.
Great. So any specific suggestion, I mean, that where you would put it in if we're going to sort of add it under emerging issues, or add a sentence or two here saying that we're cognizant of this?
So Chris, if I understand you, if I understood you correctly, if it's analysis of primary data, perhaps a sentence about the importance of how the assessment will also be analyzing how the investment in public health has contributed to outcomes in our state. And then perhaps also have a separate area where we talk about the importance of not compromising that investment in public health.
Yeah, I think it's, and thank you, Shane. Shane sent me some. So assessment of existing infrastructure. So programs, budgets, and then outputs and sort of long-term effects. So it's basically, I think if you just say public health budget, like it sounds like mush. But if you talk about the specific programs, there's really amazing thing. There's work happening. And it's just, I think it's just a matter of sort of breaking down public health and tying it to like the state health improvement metrics and to the other sort of key outcomes associated with each of the programs, both at the local level and the state level. And if we do that, if we can illustrate that effectively, I think it'll serve us. I think it'll serve us and citizens in the state well, if we can do that job of synthesizing the information across the state and communicating it.
So looking at the chats, there's
I
actually
put something in the chat box. We can
Yeah.
look at it and tweak it, but it kind of ties cost saving, investment, our assessment, and improving outcomes.
So I'm not sure if we can take that, Sarah. that statement and Chris's statement and decide where it best is inserted to get the
Yeah.
spirit.
So yeah, I'm happy to put that. And yeah, we've got a couple suggestions of wording, and then my question, and I just need clarification on, is where exactly we're wanting to put that. I think there's discussion about putting that more in the theme section, or if it needs to be here in the next steps. So just a decision on that.
So my viewpoint is, well, this is again, my viewpoint is that perhaps this goes under next steps and you know, have it stand alone, right? As opposed to in a line listing. I think this is a key component of the next steps, and perhaps it goes under analysis of primary data as a second paragraph there, you know, saying that we are aware of this, and that way it stands out. Okay. Any other comments on Chris? Is that okay with you in terms of your comments? How it looks?
Yes, 100%. Thank you.
Great. Well, thank you for bringing that up. I think this is really a critical element, and you know, you always give yourself a little bit of you know let me reword that. Your input is really critical in how we view the world, Chris. So, you know, you are a key member of our team. So I appreciate your insights. And, you know, we all view the world very differently. You are there. You are here with us for a reason. So thank you. Others, commissioners, anything else report wide that we need to discuss prior to a motion? I'm looking through my list of people.
Boris, if it's feasible at this point, can we just do a quick scroll through? I know everybody received the document recently by email this morning, but it might be helpful just to kind of regroup on the document as a whole, if that's how we're approving
So
it.
why don't you, Mina, walk us through if there's anything that you want to sort of bring to the group as we're scrolling.
Sure. I didn't. Other than the edits that I put in last night and this morning, I don't have any other thoughts. I think some of
again,
these
other than what Sarah's just added, you should also have an email. Those of you who have email connections of this latest version, so that should be available as well. Other than the any changes that have been done in the last 30 minutes, obviously aren't on your email.
Mina, would you like me to sort of just go through each section and just speak to it, or just to talk about the overall structure? And
if that's how Boris and Tosin and the commission want to handle it, I would support that.
Okay, I can do that, or if everybody, okay, perfect. So just starting then, we're beginning the report with this new preface.
Although we're going to add in a table of contents.
And we're going to add in a table of contents.
Cover page, cover page before table of
contents. Yes, the cover page, and we are working with a design team. So just also for the awareness of the commission, the final report will be have a more professional design than what you're seeing here, but we just wanted to focus on the content. So we will have that table of content, which appreciate that suggestion. Then we'll have the preface, which has been added here. Moving on then to the introduction. And then within the introduction, we have the several smaller points here talking about the an overview of the public health systems and services here. I know there was discussion then. We have the comment here to add in some more clarification about the role of the Secretary of Health in the connection to the local health departments. We have this organizational chart. And moving through, speaking more about the fundamental public health services.
just as a comment on that, because I didn't call it out earlier, I
Mhm.
did want to draw attention that I added in a sentence about including behavioral health as a public health foundational area for the purposes of this commission and in Maryland.
Thank you, Mina. Yes. Putting out and as we go through, you should be able to see these edits in the different color, which would be different from the version that was sent to you yesterday, but would be in the version that was sent to you today. So if I'm moving quickly, I'm happy to stop, as well as you should have that opportunity to read in the report that was sent to you. As you can see, we're specifically calling out health equity and population health. Selected highlights here in this timeline. And then moving on to commission activities to date. We've completed the background and the introduction, an introduction to the commission and to its structure, speaking at commission engagement. This is I mentioned at the beginning of this report, but in this commission engagement, we have the listing of the different presentations at the commission meetings. And then moving into the work groups and into how they are structured. I'm recalling to the comment here. And as mentioned before, we have gone through and updated the rosters, and we'll make sure that those are up to date before the final report. We have the table here about different work group activities, which is divided up into the different sections. So you can clearly see each of the work groups activities and the presentations and other work that they have been doing. This was directly submitted by the different work groups. I see that there is a hand raised. I'll pause to answer that.
Yes, thank you, Sarah. I'm sorry. If you can go back really quickly just to the diagram of the work groups. I'm not sure that it's clear that how it's currently outlined with 16 members. I feel like it could come across as like there's 16 members in each of those work groups. And I don't know if I'm assuming you're referring to
that's changing.
Commission. Okay. Thank you.
Yep. Thank you, Nicole, for mentioning that. We had a talk with the graphic designers, and that will, but where it says 16 members, it will just say work groups.
Okay, perfect. Thank you.
Thank you.
Yeah, thank you for pointing that out. Yes, and thank you, Megan, for highlighting that. We noticed that because it's a good point, and that is being changed for clarity. So going through the table here, they're talking about system engagement. The public engagement, specifically calling out the survey that was created by the Communications and Public Engagement Work Group. The listening tour locations, and also once again, just to clarify, as we mentioned briefly before, we are working with a professional graphics design group who are redesigning several of these figures, as well as creating the overall design of the report. So some of these figures will be redesigned to look a little bit cleaner and to have the overall look of the report to be more consistent. We're going to system and get assessment. So talking about some of the assessment activities here, note from Dushanka, which we will be sharing and updating. We have a table here about some of the key entities and partners that have been involved in the assessment and in the commission work and outlining their role.
Just as a note there, just the word officials, where it describes what MACHO stands for in the table, it should say officers.
Thank you. I'll go back and make sure that's updated. Thank you for that. And then just talking about the assessment, the emerging themes, which we have, I believe, spoken to update to issues. So that will be updated throughout the report. The assumptions. The framing questions, which is and now has this edit here from Mina to clearly make sure that the Maryland Department of Health and the local health departments have that there are clearly defined, and also working to make sure that is clearly defined throughout the report. So these framing questions. Then going specifically into the emergent themes, once again, now emerging issues. And then finally to next steps, we have this new addition of this section here under where we talk about the analysis of primary data, and then just a quick outline of the next steps here. And then quickly to talk a little bit about what we will have in the appendices. So we will have the commission membership. Once again, formatting is still being finished, and we have work to go through and make sure that they are updated, and we'll continue to do so.
Sorry.
Sure.
Page 39, can you also include my other school's affiliation? I know it's somewhere in the document, but on this page as well.
Okay, perfect. Thank you, Tosin. Are you talking about in your for your
Right.
okay.
Yeah.
Thank you. Yeah.
Right there. Yeah, I know I saw it somewhere else, but here.
Just make a comment to do that.
Yeah, thank you. So Morgan, yeah.
Thank you, Tosin.
Huh?
Listing of commissioners. We have now added the commissioner support team. And then going down into each of the different work groups. Working to make sure that that membership is updated and up to date. So we do this, and then also adding in work group support teams. So we do this for each of the different work groups. Going through quickly, but if you have questions about any specific names or work group, please let me know.
I'm not sure if I saw that. Do we have the interns' names? Do we?
Yes,
do
so that the interns
okay.
are now being listed under work group support team.
Support team. Okay, thanks.
Thank you, Tosin. And then right here at the end, we do have a timeline, just sort of a very rough overview, a quick snapshot of the work through this year, and then a quick idea of what we would be looking to do in the next year. And a list of some common acronyms that appeared in the report.
Just one additional from an earlier amendment that we discussed was to define the chief health strategist role.
Okay.
And perhaps, of course, reference it within the Public Health 3.0 system. So there, you might want to put in a placeholder for that paragraph under the public health systems section of the document.
Okay. Sorry, I'm not the human nauseous with my scrolling.
Yeah, sorry. I didn't think about it when you were going through earlier. My apologies.
Thank you.
Great. And while we're doing that, I'm just going to open up for any final comments. Michelle and Heather, we've not heard anything from you. Do you anything that you want to bring to our attention?
I just want to say thank you for all of your hard work, and this is a very, very impressive interim report, and I do think we don't have to over explain too much. I know that we want to make sure that we're getting this right, but this is far beyond the expectations of a work group interim report, and really speaks to the commitment of this entire commission. So thank you very much. And I'm I'm very excited to be able to hear the presentation as a legislator.
Great. Thank you so much, Heather. Michelle, anything from you out there?
I think the report is amazing. I think just thinking very much about the comments that were made earlier regarding the AHEAD model, and I think it's like so critical that we have an opportunity to even comment on that and to be able to provide reflections relative to what Maryland can do. And I know that, when we started earlier on, we were looking at other states who, Indiana, who had done this work. And I think us stepping into this space and thinking about what opportunities are here in Maryland and being able to lean into those things that are relevant to what's happening in the state. And I think thinking about the AHEAD model and bringing it in here has been a really great opportunity for us. And I really appreciate the fact that we're lifting equity in the way that we have done that throughout the report. And kudos to all of you. And I just want to echo what you said, Boris, to Chris. I think your insights here are different than what some of us with our public health hats have been thinking about, and really appreciate what you've been able to bring to bear to us. So thank you. Thanks, Boris.
Great. Thank you, Michelle, for that input. Anybody else out there? This is the last chance for comment on this prior to me asking for a motion.
Just for clarification, I know we had talked about addressing the testimony possibly for the HSCRC. So could we make sure we have time to?
Yeah, Chris put in a comment, and I imagine, Chris, you'll be ready to put forth a motion after we're done with this motion regarding HSCRC. We can have further discussion. And Dushanka just put in the comment saying the assessment team members to the appendix as well, Sarah. I think that would be.
Thank you. That is a great suggestion. So I'll work on to do that. And Nina, sorry, I think I just got through my scrolling, got a little lost. Were you saying to add this in the system engagement section? Is that what you were speaking about? Or was it?
No, the one where we describe the public health system, the classic image, somewhere in there.
Okay, perfect. And I may just follow up with you a little bit to make sure that it's put in the correct spot.
Sure. Thank you.
Tosin, is that your hand up?
Yes, I did a control find. Can you please add Tiffany Gambo Sanchez, intern from Morgan State? I don't see her as part of it.
All right, perfect. I'll put her in the general assessment in the support in recognition of her support for the interim report. Thank you.
Thank you.
Great. Going once, going twice. Okay, anybody want to put forward a motion?
Sure.
I put forward the motion to accept the document with the amendments as discussed.
Okay, that's from Maura. Any seconds?
I'll second it.
Thank you, Chris. We have a motion to accept the document with the amendments as have been discussed. I don't have a full view of everybody, so I'm wondering, do we, let's just go through and then I'll scroll through. Everybody for the motion of accepting the interim report with all the amendments that have been discussed, please raise your hands and keep your hands raised. Or, yeah, that's good. Or put up a hand. We have, and I'm voting for as well. Shane, can you give me a hand here to see whether we have everybody?
I am counting, let's see, 1, 2, 3. I believe 13. Oh, yeah.
13. Okay, Ray, put down your hands at this point. Anybody against putting forward this interim report? Shane, help me out here. Anybody against? Any abstentions? Did we have 13 members attending here today? Was that our quorum?
I think we had some transition.
I know, but was it unanimous based upon the attendees here today or not?
I couldn't tell if Nalesh's hand was up.
No, I saw Nalesh's hand was up. Did anybody vote against or abstain from our commissioner, just for the record? I'm not singling you out. I just need for a record because I can't follow on Zoom. So it seems I think everybody voted for. That's great. Good. Well, that concludes that part of it. Ellen, Alan Twigg, he voted yes. I saw Alan, yes?
I'm yes.
Okay, great, thank you. So anyhow, that's great. So we'll put through the report with amendments. This has been a great discussion. I will save the praises for my closing remarks. We also have another under other before I have my announcements and closure. I believe, Chris, you wanted to add something as a potential motion. Is that correct?
Yes, I think I think a motion is appropriate, but I know that that Fran suggested this, and she's comfortable and familiar with governance matters. But I think we need some sort of a motion to authorize the commission to make comments on the HSCRC activity. Help me with the language, Fran, please. Is it approve submitting written testimony? Engaging with the commission as appropriate. I'm not exactly sure what is the right motion, but ultimately it's better if the commission is basically expressing its support than just individual people.
Right. And so my thought was that we would get a motion to approve the submission of written testimony to HSCRC. That we need to do, if we're going to do it at all, we need to do it prior to the release of our interim report. So we need to do it by next Wednesday. And we haven't written the written testimony yet, but I guess the motion would be to approve such testimony as based on the elements that were just approved in the preface. To use that as the shortened, of course, but to use that as the basis for written testimony. So that would be the motion. To the extent that there may be some commissioners who would be available and willing to present oral testimony at the time of the hearing or the time of the HSCRC meeting on the 11th. I think that would be also very helpful to have FaceTime with the commissioners, to engage with them on giving perhaps some examples, to be questioned and to give some examples about some of the effective programs that have been in place for many years. So I'm not sure how to ask for a motion to approve that kind of oral testimony, because you never know in advance where that might go. So it's sort of a little bit of like, trust us, but let's put that aside and just take a motion on the floor that, Chris, maybe I'll just say a motion to approve the submission of written testimony to the HSCRC in support of the staff's recommendations on the AHEAD model. To do that, the testimony would be based on the elements of the preface and would be circulated in advance to all commissioners.
Okay, we have a motion put forward.
Mina has her hand up.
Okay, we have discussion, Mina. You're on mute, Mina.
Sorry, I'm just going to second the motion so we can move to discussion.
Okay, discussion? No discussion on this?
Just to clarify that the written testimony could just be what we've approved. If there's any concerns about the language being submitted to HSCRC,
exactly
that preface and stick it into a letter.
Right.
Okay, that simplifies things. Okay, we have a motion. We have a second. All for this motion, please raise your hands. Great. Anyone, lower your hands now. Anyone against this motion? Fran, lower your hand.
Oh, sorry.
Okay. And any abstentions? Okay, the motion passes for us to do written testimony based upon our preface. The issue of oral testimony comes up, and there's, I guess, 2 points to this. Is we do have a meeting on December 5th, so we want to sort of discuss that, who does it or how. Do we need to have somebody scheduled in? What's the process, Fran, for oral testimony?
I'm not exactly sure what the commission would like, but I'm sure we could request as a placeholder an opportunity to give testimony, and we could do that when we submit the written testimony. but we have plenty of time to.
Okay.
I'm sure the sign up will be closer to the 11th than necessary.
Okay. Great. So let's table that right now. We're going to go with the written. Okay.
Fine.
Any other business from our commissioners out there? Okay, let me give my announcements now. Our next monthly meeting is going to be on Thursday, December 5th, from 2 to 5 p.m. at the Prince George's County Government Building with a virtual option. We also have the full meeting dates for 2025. They were put in your agenda, so please get them on your calendars. They include January 23rd, February 20th, March 13th, April 3rd, May 1st, June 5th, July 10th, August 21st, and September 11th. So we have them planned until the issuing of the final report. Afterwards, I'll remind you that the commission does not sunset, but we certainly will be changing our approach in terms of our activities. It doesn't sunset until the following summer, but we'll discuss sort of what, if any, needs there will be post final report issuing. As I adjourn this meeting, I thank you for what you brought to the table today, right? I mean, there's passion. There's interest, there's comments, there's discussion, there's explanation, there's diplomacy, there's trading partners, right? There's a lot of this that really adds to the beauty of a commission like this. Last week I do this journaling thing, right? So I have this tiny little book that now has 5 years worth of journaling that I do, 1 sentence a day. And I started this in the midst of COVID. And so I can look back when I write my impressions of the day, and tonight's will be featuring you all, right? Because of what we accomplish here today. So I can tell you right now, it's going to be a Commission on Public Health single sentence of what we accomplished today. But last week I happened to look back, and on November 13th, and I sent a note to Mina and Tosin, it was the first anniversary of the 3 of us not knowing each other at all, getting together on a Zoom on November 13th last year as the announced co-chairs of this famed commission, and us sitting down for the first time saying, okay, how are we going to do this? How are we going to do this? And there was fear, there was trepidation, there was gnashing of teeth, but also there was excitement of the potential. There was a sense of where are we focused on? Where are we heading? What are we doing? And it blew my mind last week when I wrote November 13th and I looked back a year and said, oh my God, it's been a year. And then this happened to be on the cusp as where we're at in terms of reviewing this interim report and what magic can happen in a short 365-day period from going from 3 people gathered around the Zoom saying, we don't even have the working groups, we don't have anything, to where we're at now. And that's because of you. Because of the commissioners, because of the working group members, because of the public that's been engaged with us, because of the CDC Foundation, because of everybody who's involved in all this. Right? We remain on a bold and noble mission here. And it's great to reflect a year later, and now on this auspicious day with the approval of an interim report, which, as Heather has reminded us, does several things. Clarence talked about this is what the intent was. Heather said, oh my goodness, this is more than we ever expected. So this is a day where everybody pat yourself on the back because we done good, folks. That's my closing statement. Thank you so much. We'll see you on December 5th. Way to go, team.
Thank you. Bye-bye.
Great job. Thank you, everyone.
Thank you.
See ya.
Thank you, everyone.
Have a great Thanksgiving.
Bye, everyone.